Something major is happening in healthcare that's going to affect millions of Americans, and this company has a whole lot to do with it. Medicare Advantage plans are providing healthcare coverage to over 30 million Americans. But a growing number of hospitals and health systems around the country are starting to push back against these plans and drop them altogether. We're going to talk about why. I'm Adi, I'm the CEO of Cofactor, and we work with hospitals that are navigating Medicare Advantage plans every single day. And what we've learned is this is turning out to be more than just a trend. It's actually turning out to be a mass exodus of these providers. So since July, at least 41 health systems have dropped out of 62 Medicare Advantage plans across 25 states. And over the last 2 years, these payer-provider breakups have nearly tripled. And it's not just about one or two difficult payers. This is actually a systemic issue. Medicare Advantage plans set out and promised to deliver better coordinated care at a lower cost. But instead, they've just started playing a game of delay, deny, and don't pay. Most of these breakups are due to high prior authorization denial rates and very slow payments. But what's actually unacceptable in all of this is the impact that it's having on actual patient care. As the CEO of Scripps Healthcare put it, providers are at the bottom of the food chain, and the food chain is just not being fed currently. And the irony is, providers are leaving these plans to protect their patients, but when they drop these MA networks entirely, their patients lose access to care entirely. Over 32 million Americans are enrolled in these Medicare Advantage plans. And when their doctor's office suddenly becomes out of network, they're faced with a choice. They either go find a new doctor who accepts their new plan, or significantly pay more to stay with their current provider. And for a lot of patients, especially the ones with very complex conditions who've built deep, lasting relationships with their care teams, this just isn't a choice for them at all. And what's making this particularly concerning is how aggressively these patients are being pushed into these new plans. In 2007, just 19% of eligible Medicare beneficiaries were in MA plans. And today, it's 54%, more than half of all Medicare beneficiaries. All the while, the number of providers that are willing to accept these plans is shrinking. And the real kicker is that Medicare is paying 122% more for MA enrollees than it would spend on similar patients in traditional Medicare. Yet that extra spending isn't translating into any sort of better health outcomes or more affordable care for patients. And this has nothing to do with just reimbursement rates. It's entirely about whether the current MA model is even sustainable. Providers cannot afford to participate. Patients are losing access, and the administrative burden just continues to grow. But it turns out there is another way. At Cofactor, we're helping hospitals fight back against these inappropriate MA denials by recovering revenue that's rightfully theirs without forcing them to exit these networks. Because there is a real solution that isn't just leaving the plans. It's fixing these broken processes that are driving them away in the first place. If you're an RCM leader that's dealing with these rising MA denials, we've put together a BCBS-specific root cause analysis that breaks down their most common denial patterns and how you can fight them effectively. Just comment BCBS down below and we'll send it your way. Because the answer to this crisis isn't less access, it's simpler, smarter defense.